part of the reason for a hospital stay is to recover from a procedure or illness. Why is it so hard to get any rest? That's the topic of this week's Healthcare Triage. Special thanks to Austin Frack, from whose Upshot column this episode was adapted. Sleeping in a hospital is not easy. They're brightly lit and they're loud, which are not ideal sleep conditions for most people. They're also busy. Nurses and other staff drop in frequently to give medications, take vitals, draw blood, or perform tests and checkups, in many cases waking patients to do so. Some monitoring is necessary, of course. Medication must be given, some vital signs do need to be checked, and frequent monitoring is needed for some patients, like those in intensive care units. But others are best left mostly alone. Despite this, many hospitals don't make this distinction, and they disrupt all their patients on a predefined schedule. Peter Ubel, a physician scientist, understands the problem as both a physician and a patient. When he spent a night in the hospital recovering from surgery in 2013, he was interrupted multiple times by blood draws, vital sign checks, other lab tests, as well as by the beeping of machines. Quoting him, "Not an hour went by without some kind of disruption. It's a terrible way to start recovery." It's more than annoying. Such disruptions can harm patients. Short sleep durations are associated with reduced immune function, delirium, hypertension, and mood disorders. Hospital conditions, including sleep disruptions, may contribute to post-hospital syndrome, the period of vulnerability to a host of health problems after hospitalization that are not related to the reason for that hospitalization. It's an environment that all too often seems set up for everyone else's convenience but the patient's. To help patients deal with the stresses of hospitalization, sedatives are often prescribed. These medications, including opioids, carry their own risks, such as addiction. Solutions aren't hard to fathom, and Dr. Ubel listed some in 2013. Hospital workers could coordinate so that one disruption serves multiple needs. A blood draw and a vitals check at the same time instead of 2 hours apart. Or they could allow patients' needs to guide the schedules. If a patient's at low risk and can go 6 or 8 hours without a vitals check, for example, perhaps don't do that check once every 4 hours. Small changes in hospital routines like these can go a long way. A clinical trial to test them found that they significantly reduced the proportion of patients reporting hospital-related sleep disruptions, and they cut sedative use in half. These small changes can even increase patients' ratings of hospitals, which are now a part of Medicare quality measures. The key insight seems to be to prioritize patients over tests and other interruptions that can be deferred. Some hospitals are trying to allow patients to get more rest. Yale New Haven Hospitals empowered nurses to change medication schedules to minimize sleep disruptions and to tick off other tasks before patients go to bed. Another example, to reduce noise, Massachusetts General Hospital in Boston has installed rubber floors in some areas. The University of Michigan Health System has taken steps to reduce noise at night, including changing when floors are cleaned and installing sound-absorbent tiles. Being sick and hospitalized is bad enough. Being subjected to sleep deprivation adds insult or more injury to injury. Hey, do you like the show? Helps if you like it down there or even subscribe to the show. We love that. But another good way to support the show is a subscription service called Patreon.com. Patreon allows you, the viewer, to donate any amount of money you like, even $1 a month or more if you want, it doesn't really matter, to help support the show and make it bigger and better. You can go to patreon.com/healthcaretriage. And while we've got you, great merch at HTTmerch.com, my book, The Bad Food Bible, still on sale in stores. And back to Patreon, we'd especially like to thank our research associate, Joe Sevitz, and of course, our Surgeon Admiral, Sam. We really appreciate the support.